The state is slowly reopening. We've been in phase 1 for 1 week. So what is the COVID-19 threat now? In today's To Your Well-Being, we are breaking down why social distancing is just as important now as when the pandemic first started. Cone Health's Chief Physician Executive, Dr. Bruce Swords, is joining us. So let's start with this. If people do not continue to social distance, phase 1, phase 2, don't wear masks, what do you say will happen?
It's pretty clear what will happen, and we know this based on our own experience in this country, is the disease will increase. People will transmit this disease just like they have for the past several months. And the only reason that we are seeing that there are fewer cases in the country now than there were previously is because of social distancing.
All right, so let's follow up with that. What should people do to help control COVID-19 as more areas reopen? Social distancing is one of those key factors.
Yep. So it's one of them. It's probably the most important. The other actions that people can take is continue to wear masks. Masks are important out in public, especially in areas where there's a high density of people. And I'd remind everybody that the masks are not as much for your protection as they are to protect others from you potentially having COVID-19.
Yeah, and we're already getting a few text questions about masks, so we'll definitely go through a whole bunch of them. But I've got one more question for you. As we practice social distancing, an important way to help our community through the pandemic, they say, is to donate blood. So can you kind of talk us through this?
Yeah, great question, and it's a need in our community. And thanks for asking. It turns out that people who regularly donate blood are doing that less often now, and I think it's because they're trying to practice social distancing and stay away from each other. Donating blood is safe. It's important for patients who have COVID because they frequently require blood, and it would be a direct ask from your hospitals, your physicians, to please go donate blood because it helps patients who have COVID-19.
Gotcha. And of course, there are plenty of safety measures in place as well when you go to donate blood.
There is no risk of donating blood, period.
And so that is the answer. There is no risk of donating blood when you go. Okay. And that is something as simple as making an appointment with the Red Cross. I know a lot of times people say, well, I don't want to have to sit there for a while in the waiting room and all that other kind of stuff. Well, you don't have to. You can make an appointment with the Red Cross and be able to choose whatever time you would like to go. So someone is asking, have there been any new coronavirus symptoms identified?
The symptoms of coronavirus continue to expand, and nothing dramatically different, but we certainly are learning more. And the typical symptoms, shortness of breath, cough, chills, muscle aches, loss of taste and smell, those common ones. If you read reports about skin findings in children, there's probably something there. We think that COVID-19 increases people who are infected with COVID-19, their clotting mechanisms, so they might present with more strokes or heart attacks than what otherwise might be a risk, for what they might be at risk otherwise. So those symptoms are much less frequent. Pay attention to fever, cough, shortness of breath, loss of taste and smell.
And once again, to reiterate that, since you said that there's some heightened there for those with heart attack or stroke, if you're feeling those types of things, you need to go to the emergency room. Do not stay away from the emergency room.
Absolutely. There across the country, there are fewer people who are seeking emergent care for conditions where they really should be seeking emergent care. Do not stay at home with even the slightest concern of a stroke or a heart attack. Go to the emergency departments. Our health systems, our hospitals are safe. seek care when it's emergent.